Welcome viewers to the final call. I am Abigail Eje, midwife for the final call team. Today, we are going to talk about a condition that affects only pregnant women. And that condition is PRE-ECLAMPSIA. PRE-ECLAMPSIA, someone would ask what it is. It occurs only in pregnancy. And some of the signs are high blood pressure with minimal or significant protein in urine. The symptoms: the patient may complain of a burning sensation, epigastric pain. The patient may also complain of blurry vision, headaches that does not resolve with pain medications. The patient may complain of nausea and then vomiting. The patient may look edematous and then sometimes very weak. So, management. PRE-ECLAMPSIA cannot be managed in the house. It is managed in the hospital. The patient will be hospitalized and then treated. The patient will be treated with antihypertensives, which will reduce the high blood pressure. The patient will also be given anticonvulsants to prevent seizures. And then, depending on the gestational age, the patient may have to be delivered by C-section, which is the best, depending on the gestational age, as I said earlier. The complications of PRE-ECLAMPSIA. We have fetal complications. So there may be stillbirth. There may be intrauterine fetal growth retardation. And then we will have a baby who will be born preterm. Babies who will have low birth weight after delivery. And then the babies may also develop a lot of complications after delivery. We will want to talk about some of the maternal complications. There is a condition called HELLP syndrome, hemolysis, elevated liver enzymes, and low platelet count. When the patient gets to this stage, management becomes very difficult. And in most instances, if the patient is not managed properly, the patient may end up losing her life. We have organ damage. The kidneys, the brain, the heart, the lungs are all affected. The kidneys may perform badly. The urine output may be so bad such that the color of the urine will turn black. The liver may be enlarged. That is the reason most of the patients will complain of epigastric pain. Elevated liver enzymes may signify the liver shouting for help. All liver enzymes will be elevated, indicating some form of liver damage. And then the lungs, you will hear a lot of crackles on auscultation. There will be pulmonary edema as a lot of water will be retained in the lungs. During pregnancy, if a patient gets this condition and is not attended to immediately, the patient will have placental abruption. The placenta will detach gradually, which will lead to fetal hypoxia, and then in the end, the mother losing the baby. There will be DIC, disseminated intravascular coagulation. You see, we talked about HELLP syndrome. The patient has lost a lot of platelets. Platelets helps with coagulation. Now, this woman had HELLP syndrome and all her platelets are gone. So in the event of any form of trauma, the mother will bleed to death. There will be pulmonary edema, as we talked about. So there will be a lot of fluid accumulation in the patient's lungs. The patient may have stroke due to a high blood pressure, if not controlled. And then lastly, when all these factors are there, the patient might lose her life. It is therefore important for all of us to talk to our pregnant women who are seeking to get pregnant, to seek for pre-conception care. In this way, you are cared for properly. If there is an underlying condition like a kidney problem prior to pregnancy, chronic hypertension, any condition that persists before pregnancy is controlled or treated before pregnancy occurs. How do we prevent pre-eclampsia? We have to manage all underlying conditions, just like I said earlier. So if you have hypertension, a chronic hypertension, it should be reduced to normal before pregnancy occurs, as pregnancy has its own complications, so that it doesn't compound what is already existing. Then you have to have a balanced diet with a lot of calcium. It helps with regulating blood pressure. Then you have to regularly visit the clinic for any abnormality to be detected earlier. This way, we try to prevent this condition from happening. Or if it happens, then we'll be able to treat it as early as possible to prevent all these complications. HELP syndrome. So there is hemolysis, that is rapid breakdown of the red blood cells. There is elevated liver enzymes. So we have enzymes that are peculiar to only the liver, and a quantum of them in the blood will signify something going on. So we have ALT, which is one of the main liver enzymes. You will see that liver enzyme highly elevated. It gives you a clue as to what is really happening. So there is a low platelet count. So platelets are some tiny structures in our blood that helps with coagulation, clotting of the blood. When you have a cut on you, and immediately the platelets come into play to help stop bleeding. These platelets will be lost during this condition, and if not treated early, you will lose all your platelets. So in the event of some amount of bleeding, there wouldn't be any form of help to help stop the bleeding. So all your blood will come out. And in this case, we've said that this pregnancy is not to term. So we might want to intervene, bring baby out to somehow help with the progress of the woman. If we go to theater and then this patient has all her platelets gone, it means that when an incision is made, this lady will bleed throughout that incision and there wouldn't be any blood left. So the woman will bleed from the incisional site and then there wouldn't be any help for her. And sometimes it is very difficult to get some of the blood product to help stop this condition. So it is better this condition is treated earlier than to get to the latter stages where not much help can be done for the woman. So someone would ask, how do I prevent pre-eclampsia? Pre-eclampsia cannot be prevented entirely, but there are some factors that can predispose you into getting pre-eclampsia. If you want to become pregnant, it is ideal that you seek for preconceptional care before pregnancy. If you have an existing disease like a kidney disease, a chronic hypertension, a diabetes, any form of diabetes, any condition that may compound your situation during pregnancy should be put into check. So if you are hypertensive, you have to see your doctor to make sure that your BP is well controlled. If you have an existing kidney disease, you make sure that that disease is controlled to the minimum so that in the event of a pregnancy, you wouldn't experience those complications. Even if they come, they wouldn't be as bad as someone who did not control it at all. So another thing is, if you want to prevent it in a way, if you are a smoker, if you are a heavy alcohol, you take in alcohol, if you take in drugs, you will have to put all of those things aside and then see your OBGY, obstetrician gynecologist, and then plan with him to make sure that you are in optimal state before pregnancy. In conclusion, pre-eclampsia is not managed in the house. Pre-eclampsia is managed in the hospital, and the earlier you seek for care, the earlier the better. Thank you for listening. Please subscribe, like our videos, and share.